former ACP semester student. Today I discuss about the subject of community health nursing 1. My topic is communicable disease. I give some clues and you guess the topic. Okay. The final symptoms is diarrhea, abdominal pain, and vomiting. It is not basically only the bacterial. It is also can be a viral due to viral infection. Okay. Anyone can guess? Stand up. Person? Yes. Sit up. Yes. My topic is food poisoning. Food poisoning is a condition where the food's toxic bacterial either living bacterial toxins are affected our intestine and it can be read as food poisoning. The food poisoning has three characters. First of all, the character is, I write down and you. Food poisoning has the same kind of symptoms. Okay. It affects many persons at the same time. It is happened due to ingestion of common food. Basically, the same food can cause the food poisoning. If I can take one food and you are also take some same food, then it is caused by you also and me also. Food poisoning is a gastroenteritis, acute gastroenteritis. Gastroenteritis means inflammation of gastric cells. Gastroenteritis. I don't know. Inflammation of gastric tissues or cells. Because it affects our intestine. That's why the cells have become inflamed. So food poisoning is an acute gastroenteritis caused by ingestion of food, contaminated food or water or drinking fluids that is either living bacterial or their toxins or their chemicals or poisons arrived from the plants or animals. Can you understand? Anyone stand up and told me what is food poisoning? Then incident rate. How many persons are affected by the food poisoning? Okay. Then worldwide it is 600 billion people. 600 million people. Can you imagine the large amount of people are affected with food poisoning? In India, because we are living in India, we have to gain the knowledge about the Indian culture. It is 100 million. And 4 lakh 20,000 people are died in the case of food poisoning. It is the study of frequency, distribution, and determinants. Epidemiology chart has three components: agent, host, environment. In agent, the bacterial agent and the virus agent are mainly cause of food poisoning. Can you see? Bacterial agent. Clostridium perfringens. Then Staphylococcus aureus. Staphylococcus aureus basically spread through the meat, chicken, eggs. Campylobacter. It is spread through the poultry. If the poultry is undercooked, then the bacteria spread through our body and cause food poisoning. Salmonella. These bacteria came from the poultry, meat, eggs. You have to cook them properly, then we have to eat. Okay? Then viral agent. A cause of food poisoning. Humans and animals are the main two factors that are the host factors. Humans, if we do not wash our hands properly, if we do not cook the raw items properly, it can spread to our body. Animals are also the host. In environment, poor food handling. I already told that if we do not cook the food properly, it will affect our intestine. Then unhygienic environment. Unhygienic means if we do not clean the surface of utensils, another items, instruments, then we are actually if for example, I put one piece of meat, I cut the meat with one knife, and I gradually clean the knife in running water. Do not clean it properly, and after that I cut the vegetables with the same knife. It will affect our health. It will be the cause of food poisoning. Understand? Anyone stand up and told me the environmental factor, unhygienic environment, poor sanitation, not proper handling the cooking food. Mode of transmission. cross contamination. If the water what we drink regularly is dirty, then it is the cause of people to oral. It means after using the toilet, if we do not wash our hands properly, and some dirts are stick in our hands, and we after the use of toilet we eat with the dirty hands, and it cause the food poisoning. Direct contact with coronavirus is an example of direct contact. Then I already write there inadequate cooking and storage. Inadequate cooking, I already told that if we do not cook the food properly, it is a cause of food poisoning. Infected individuals, after using the toilet, if we touch the food items, or if we put the raw food beside the cooked food, it will the cause of food poisoning. Always separate the raw food from the cooked food. How do you understand? Then clinical manifestations. Clinical manifestation means the final symptoms. If we are affected with the food poisoning, at first the first symptoms are seen in our body is diarrhea. Due to diarrhea, our body became dehydrated. Means dehydration. Then watery stool means diarrhea, fever, abdominal cramps, and vomiting. Due to excessive loss of fluid and electrolytes, we are also seeing that the muscle cramps, then weakened muscles are also present as a clinical manifestation of food poisoning. Risk factor. Anyone guess what is the risk factor of food poisoning? Okay, let me tell you. Children are the most affected persons. Older adults are pregnant women. Then immunocompromised individuals, people who are traveling a lot. These are also the host factor. Host factor, age people, immunocompromised people, they have HIV positive or AIDS positive patients are also can the risk factors. Then diagnostic evolution. As a nurse, we have to know that every patient they come with their disease, we have to first check their history, then physical examination. Then we have to check the blood test, then stool test, stool culture will be there, then food test. Primary prevention, secondary prevention, and properly. Store the food in the clean and hygienic area and utensils. We have to do our hygiene maintained by frequently hand washing. Store the food in clean area. Avoid cross contamination. Always separate the food from raw food to cooked food. In secondary prevention, we have to determine the disease, act on the disease condition, investigate on the disease, and report to public. At first, we have to detect the disease. That how many people are affected with the foodborne disease. Then after that, we have to act or respond on the detection. Okay. Then we have to investigate pain areas or investigation. What is the reason of food poisoning in the area? It can be dirty water, contaminated water. It can be cause of cross contamination. Then we have to inform the public how to prevent the food poisoning. Okay. Then tertiary prevention. In tertiary prevention, generally we are give treatment to the patient who are affected with the foodborne disease or food poisoning. In tertiary, can you guess what is the treatment we provide to the patient? See the manifestation and you can take. What are the treatment we can give the patient for their symptoms? See that. At first, in tertiary prevention, always check the vital signs of the patient. Then we have to check the hydration status of the patient and also nutrition status. We have anti-complications. If the patient having severe food poisoning case, then we have to admit the patient in the hospital. In medicine, we have to provide antibiotics and antiviral drugs. And for antibiotics, we can give doxycycline. Antiviral drug, we can provide the patient loperamide. Do you understand? Okay, done. Then complications. In complications, the patients are having septic shock. Septic shock means infection shock. If the patient having severe infection, then the patient patient will go for fatal shock. Then hypovolemic shock. Hypovolemic shock. Organ failure. Kidney damage. Dehydration. These both are the complications of food poisoning. In nursing assessment, we have to check the patient vital signs. Then we have to collect all the history of the patient. Then we have to assess the complications like dehydration, vomiting, nausea, which are the complications the patient is having. Then we have to assess the patient for their complications. Like we have to provide the IV. Then we have to give ORS. We have to provide the drugs to the patient. Then nursing diagnosis. You see the time poster and anyone tell me what are the nursing diagnosis we can do for the patient? Vomiting. As well as due to acute vomiting or diarrhea, at first we have to deficit fluid volume related to vomiting as evidenced by decreased urine output. That can also be a diagnosis for food poisoning. It can be bacterial or viral. Okay. Due to excessive fluid loss, it can be risk of electrolyte imbalance. Okay, done. Can I bring the phone? Anyone tell me what are the complications of poisoning? Now we have to provide again education to the patient how we are handling the preparation of food poisoning. At first we have to handle the food properly, like we have to store the food in clean utensils, then we have to use the clean equipment and store the food in clean surface area. Then we have to advise the patient to take proper rest. Then we have to advise the patient to take proper food and nutrients. Then we have to advise the patient to avoid cross-contamination. Then we have to advise the patient for frequently hand washing. Okay? Are you understand? Then anyone told me what are the preventive measures of health education I recently said. Vaccines, no? Anyone? করছি মানে টাইম করবো ফুড ওয়াটার দিয়ে ভালো ক্লিন করতে হবে। Summarization. In summarization, I discuss the topic of food poisoning, the incident, the introduction, definition, incident rate, epidemiological trial, then mode of transmission, then clinical manifestation, risk factor, diagnostic evaluation, preventive methods, then complications, then nursing assessment, nursing diagnosis. After that, health education for a patient with hot food poisoning. In conclusion, food poisoning is basically we treat it in our house, but if the patient is having severe food poisoning case, then we have to admit the patient into the hospital. Okay, it can be spread from the bacteria or the virus or their toxins. So today I close my topic.